Good afternoon, one and all. I shall be presenting the analysis of my data of enucleation in adult population in Asian Indians over a 22-year period. I have no financial disclosures. We all know that enucleation is still the end-stage procedure of choice for end-stage ocular disease, and the patterns of enucleation with respect to the pathologies leading to enucleation as well as the incidence of enucleation varies across the countries and over the years. In a study from United States at Mayo Clinic of 523 enucleated globes, tumors followed by end-stage glaucoma was the most common cause of enucleation. In a study from Germany, of 1123 enucleated globes, trauma followed by tumors was the most common causes of enucleation. These outcomes were similar to a study from Tongren Center at Beijing, where trauma and again tumors were the leading causes of enucleation. In a study from Iran, the most common cause of enucleation leading were painful blind eye followed by leukocoria. We have limited number of studies from India. From PGI of 28 enucleated globes, the inflammation and infectious causes leading to enucleation were 39.5%, followed by tumors. And from Shankar Netralaya, they have noted that over a 15-year duration, that RB followed by trauma was the most common cause. We had studied over a duration of 22 years from January 1996 to March 2018 from a single center with all the population who underwent enucleation beyond 20 years. The histopathological diagnosis was reviewed and the data was analyzed based on the age, clinicopathological correlation, and the age and the year at which the enucleation was performed. Coming to the results, we had noted that there were 304 males and 174 females in the population who underwent enucleation in adults, and the mean age at enucleation was 42 years. The population was again further subdivided into middle-aged with greater than 20 to 60 years, and greater than 60 years was considered as old-aged group. 87% of the population belonged to middle-aged category, and we noted that most of the enucleations were seen in between the 3rd to 5th decade of life. This could indicate that there is an increased socioeconomic burden as well as it can affect the quality of life. Coming to the clinicopathological correlation, we had good clinicopathological correlation at 96%. In our study, we defined primary enucleation when it was done as a primary treatment of choice for the ocular pathology, and secondary enucleation when other conservative measures failed. Most of the patients underwent primary enucleation, indicating that the globe was non-salvageable at presentation. Coming to the etiological factors leading to enucleation, the most common cause which led to enucleation was malignant tumors, followed by sequelae of prior trauma or infection leading to phthisis or atrophic bulbi, and acute trauma leading to enucleation in around 69 patients. Among the malignancies, uveal melanoma was invariably the most common cause, with 34% of the patients leading to who underwent enucleation, and followed by OSSN. In the middle-aged category, phthisis or atrophic bulbi was the most common cause of enucleation, followed by choroidal melanoma and acute trauma. In the older age, with greater than 60 years of age, the most common cause was again choroidal melanoma, followed by phthisis or atrophic bulbi and ocular surface squamous neoplasia being the third cause. Across the decades, when we noted, in the third decade, the most common cause was phthisis or atrophic bulbi, whereas in the 4th to 7th decade, the most common cause was uveal melanoma. This indicates that there is a need for early diagnosis, early referral, as well as early management of uveal melanoma. Coming over the years, there was a decreasing trend in number of enucleations, with a peak noted between 2006 to 2010. And over the years, as we noted the trends, we have seen that there is a decrease in trend for enucleation for trauma and phthisis or atrophic bulbi. This could mean that there is an increased quality of care as well as preference over evisceration for enucleation for trauma. And there is an increasing trend for intraocular malignancies leading to enucleation. Overall, we found that malignancy was still the most common cause of enucleation in adult populations, and early referral, early diagnosis, and early management might reverse the trend for enucleations in the future. These are my references. Thank you.